Good afternoon, everyone. My name is Dr. Jodie Guest. I am a professor and infectious disease epidemiologist and vice chair of the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team working in harder hit communities across the state of Georgia, providing vaccinations and testing. And I'm the host for Emory's COVID-19 videos where we cover important topics about the COVID-19 pandemic. Today, I'm very pleased to be joined by Dr. Henry Wu. Dr. Wu is an associate professor of infectious diseases at Emory University School of Medicine, and he serves as the director of the Emory TravelWell Center. Dr. Wu previously served as a medical epidemiologist at the Meningitis and Vaccine Preventable Diseases branch at the Centers for Disease and Prevention. And today we're going to be calling on him about his travel advice as we all prepare for the Thanksgiving holidays. Good afternoon, Dr. Wu, and thank you so much for joining me.
Good afternoon.
We're going to be talking about how best to travel safely this holiday season, but first we're going to start with an update of COVID-19 numbers, as it's important that we move into the holidays understanding where we are in this pandemic. Beginning October 26th, about 3 weeks ago, we saw the previously declining rates of COVID-19 start to plateau at around 71,000 new cases a day. This plateau has lasted for about 2 weeks, but we are now seeing cases begin to increase again with a 7-day average of around 86,000 new cases a day. This is an 18% increase in the past 2 weeks. And perhaps more importantly, the current rate is still more than 6 times higher than it was in June before the Delta variant began to take off across the United States. Cases are not evenly spread across the United States, with most of the hotspots in the upper Midwest and continuing high infection rates in the West. Michigan and Minnesota lead the country in recent cases per capita. Both of these states avoided the worst of the summer surge from Delta, but have seen the average daily caseloads increase by more than 60% in the past 2 weeks. The South, which was very heavily impacted by Delta this summer, continues to have fewer cases than any other region in the United States. But I do want to caution, case rates are beginning to increase again in the South. Daily death rates have decreased, but we still have more than 1,000 deaths a day in the United States. And this is avoidable, and this is a tragedy playing out every single day. We cannot become immune to hearing these numbers. Hospitalization rates are staying close to an average of 40,000 people a day in the United States. But again, with increasing rates of new cases, we should expect to see hospitalization rates increase again. 59% of the US population is now fully vaccinated. Almost 69% of those 12 and older are fully vaccinated, and 86% of those over the age of 65. Additionally, 37% of those over the age of 65 have now also had a booster shot. Dr. Wu, we are 1 week away from Thanksgiving. Last year, we all advised that the safest way to celebrate Thanksgiving was to stay home. This year is different thanks to vaccines, but we're still in a pandemic, so caution and planning is still a priority for safety, so we can all get to the goal of enjoying each other's company. So let's begin with some very general tips about how to travel during these holidays.
Great, thank you. Well, as you pointed out, there's still cases and even rising in certain parts of the country. So the big difference though this year is obviously we know so much more of how to prevent COVID. We have vaccine that is safe and available for the majority of Americans, and even booster shots increasingly available. So I really encourage folks to see their families, do the things that you couldn't do in the past year. It is time to catch up and see your loved ones. But also remember that you can always make these trips and gatherings safer. So just remembering everything, and first and foremost, again, vaccination. If you're not vaccinated yet, if you have family members who are eligible but haven't been vaccinated yet, I would encourage them or get them vaccinated. This will always be our safest, most important intervention to protect ourselves and the people around us. Secondly, don't forget the basics in how to make travel safer, avoiding crowds, particularly when there's a lot of different people from different places, unmasked, and avoiding poorly ventilated areas. In particular, outdoor things are always going to be safer, and above all else, remembering that nothing is perfect, but we can layer these approaches and really make whatever trip you're doing or whatever gathering you're hosting much safer. And I think I feel much more empowered this year, whereas last year, we were all kind of not getting out as much. And if we did, we were, often in fear of catching or spreading something. But this year, I think we can all use these tools, feel empowered to do things safer and really enjoy our time with our families.
I like the way you talk about empowering us to do this safer, but making sure that we are getting together with groups. Let's talk through some very specific examples of ways to keep particular members of our family or our friends safer. So if we're traveling with an unvaccinated child, and this is probably going to be, anyone under the age of 11 is not going to be fully vaccinated at this point in time. Is driving or flying safer if we're going to see grandparents or other family across the United States?
A great question. The advantage of driving certainly would be that you can control the environment, in terms of who's in the car, where you're going to make your stops. And that does reduces the exposure risks, for somebody who is susceptible for infection. Obviously, flying is maybe the only option if you're going far away or have a very limited window. But I do think if you're comfortable and able to do the road trip, at least from COVID, terms, it is going to be a bit safer in terms because you can control, all your close contacts. Flying certainly is safe, again, in the sense that the aircraft are very well ventilated and air is very well filtered. But as we know, when you go to the airport and get on a plane, there are many situations where you are in crowds. And although masking is still required in these situations, as masking may not be perfect, and certainly masks slip all the time off people. And we often find ourselves in that crowded jet bridge, and it's flying does inherently add some exposure risks.
So let's talk about what we need to protect those around us during the holidays. We now have kids 5 to 11 who can be vaccinated, but even if they've begun this vaccination series, they cannot be fully vaccinated yet, although even one vaccine is going to offer them some level of protection. How best do we keep them safe? Do the adults around them form a vaccine bubble for them, or what else should we be doing to keep these children safe?
Well, certainly the more persons that are vaccinated, the safer it will be for anyone who's under vaccinated, partially vaccinated, or maybe their immune system is impaired and they may not respond well to vaccines. So the idea of the vaccine bubble is a great one. It means, getting folks who are eligible in your family and who you're gathering with as much as possible to be vaccinated. And that will certainly make it much safer. The reality is, the vaccines are extremely effective in reducing your chance of being infectious. And I think it's one of the easiest things you can do, because you are correct. Not all our children will be fully vaccinated. Some of the younger kids are not eligible yet. And there may be others who are susceptible in your gatherings.
So as parents prepare for the holidays, I think, there's this response to say, for a bunch of parents, they want to get their child vaccinated as quickly as possible, and starting the series feels empowering, to use a word you've been using about these holidays. But there are some that are going to say, I can't get it fully done before we're going to gather next week. Do you recommend that they go ahead and get started, even though it won't be at the full level of vaccination?
Certainly. I would encourage everyone to get vaccinated as soon as they can if they're eligible. Even one dose appears to have some level of protection. And remember, our holidays season goes on, for the next 6 weeks or so. So there'll be a lot of gatherings, parties, and things that are happening. So getting started as soon as possible will get everyone to that immunity level that will really make things safer.
Great. So many of us could not gather with family and friends last year as rates of COVID-19 soared, and we didn't have access to vaccines yet. My family is traveling to see family out of state this year for the first time since November of 2019. We're all fully vaccinated, the adults are boosted, and we do have plans to test before traveling. So this is a conversation I've been having a lot with family and friends. We're going to be families from 3 different family units and different parts of the country coming together. So we're taking additional precautions like testing before gathering. What kind of testing regimen do you recommend? And let's talk through the different kinds of tests, when to best use them, and if we need to be doing sequential testing.
Sure. You know, certainly we've all become familiar with the various tests in various degrees. There, our gold standard PCR test, which is a molecular test that's very sensitive to pick up infection even before somebody might be developing symptoms. The more easily available rapid tests, what we call the antigen tests, and that's what you might see at the drugstore, or maybe some clinics are using it. It certainly is easier to do and get a quick answer, but it may not be as sensitive in picking up all infections. However, both of these I think can be very important when planning a trip. And again, you taking full advantage of them is something I would recommend. First of all, note that there may even be requirements for travel, particularly going overseas, of getting a negative test, say, when you come home before you can return to the U.S. And CDC still recommends that at minimum, folks who are unvaccinated consider getting tested when you return, even from a domestic trip. But what I would do is, think more in terms of what you can do to make this gathering and your family safest. Let's put aside all those red tape requirements and just think, how am I going to visit and get a gathering of 3 families from different parts of the country? And the idea is we're going to lower that risk by all getting vaccinated if possible, as much as possible. Secondly, in the small chance that we have a breakthrough infection, maybe we can catch it before we even get together. And probably the most sensitive way to do that is to get that PCR test before your trip, if it's available. And and when you are together, if you have access and can get those rapid antigen tests, I think it's potentially very helpful to do even some testing, while you're, getting together wherever you are. And again, there's no hard number of how many times, you need to do it, or, except that generally speaking, since none of these tests are perfect, and you can suddenly be negative one day and suddenly positive the other day, generally speaking, the more tests is going to be more sensitive in picking things up. Obviously, there are practical considerations. Even the antigen tests, they're not. They have, they do cost some money, and so I don't expect everyone to be testing every day. But you have no doubt that there are some folks who are doing that to just really maximize, the protection. Probably the best way I can put it is I'm going to be visiting my parents this holiday season. My dad is, and mom and dad are in Hawaii. They are very frail and elderly. My dad has severe COPD. He is fully vaccinated and gotten his booster. That's the great news, as well as myself. At the same time, I'm always extra careful around him because, to be honest, even the common cold can put him in the hospital. So, and so I'm going to get my PCR test before I fly home, even though it's not required. And I plan to take a few antigen tests while I'm at home, just in case something happened and was missed, by the PCR test, or maybe I got infected during my transit to Hawaii, which should be minimal because I'm going to be masked up and avoiding high-risk situations. But just in case, because again, I don't want to take any chances with my dad. But otherwise, I think my visit home is going to be just like normal. I'm going to be hanging out with them, staying in the home. But again, some of these extra precautions can go a long way, particularly if you have a child who's not vaccinated or fully vaccinated, or a family member who's just medically frail.
I'm so glad you're getting to go home and see your family. And it sounds like you're following a pretty similar testing regimen that we're going to do with my family. We're going to be doing a PCR before we leave. I do think it's important to remember that a PCR test does take a few days to come back, and that's variable depending on the lab you're using and where you are in the country. So you probably need to plan for at least 48 hours to get those results back. We will also be doing rapid antigens before we get there. I just want to make a fine point on using one rapid antigen before you go into someone's home. If you don't have a comparison test, there's a window where those tests are not particularly sensitive. So if we were using antigens without a PCR comparison, would you recommend a couple antigens spread across a few days if people can get to those tests?
I think so, because it isn't as sensitive as you mentioned. you can improve, the sensitivity by doing multiple ones if you have access to that. Again, the good news is they're easily done on yourself. Again, it's not a free test, and yet it's not prohibitively expensive to do multiple testing. And I would encourage folks, that would be one of the ways you can really reassure yourself and your family if there's somebody that may be more susceptible. That again, this is all about getting together without worries or fear, and I think this is just a way to really minimize that. Again, you certainly want to be bringing all the good things in the holidays when you get together, and certainly not, but you don't want to bring unwanted infections, and so I really agree. I think we are fortunate to have access to home test kits, which can be used. Just recognize their limitations, but they certainly have a very potentially important role to play.
Wonderful. So Dr. Wu, as we wrap up here, is there anything else that you would suggest people do to prepare their homes for gatherings? Do we need to all have our windows open during Thanksgiving? What else do you recommend as we all aim to get together as safely as possible?
Sure. I think the key lesson from the past year is that whether or not something is high risk for COVID or not depends on so many factors, and of course you may not have full control of who's going to be vaccinated among your guests, and then some folks can't get vaccinated, so you can make things safer on your end if you're planning a get together. And ventilation is a huge factor we've noticed, and in terms of how readily this virus can spread. So the old sort of thing we've been saying for the past year, outdoors is always safer. It still applies. If it's possible, if the weather's good, outdoor gatherings or something, at least partially outdoors is always going to be safer. If that's not possible, then certainly indoors, it can be safe. Again, maybe you may have to just limit the number of folks that are coming, particularly if they are not all vaccinated, or if there's susceptible persons in the group. Maybe opening a window, or increasing the air circulation if you do have control over some sort of air conditioning system. The idea is that the situation that we are all familiar with. You're in a crowded room. You can feel the humidity in the air rising. You can kind of smell everyone's perfume and their body odors. That's the situation that should set off some red flags that maybe the air is not exchanging well enough. So that's the way I enter any situation, whether it's a party or just a meeting or an elevator. Even if I sense that, oh gosh, there's a lot of folks here and the air exchanges are not as good, that's sort of a situation I'd try to either get out of or change the situation. Open a window, let's move something outside. Other things you can do, obviously, if there are susceptible persons, then wearing masks maybe is still a good idea. Again, if there are unvaccinated persons in the group, and I think we've all kind of gotten used to it, and I really don't think it's that difficult for many of us to take that extra precaution, and just I think just setting a tone where it's clear that you're being mindful of everyone's health. Maybe putting out some hand sanitizer just so folks when they're rubbing their noses and blowing their noses have an easy way to clean up. And it's I think it's the little things but and none of these are foolproof or perfect, but the more you can layer them up, the more safer a gathering can be. And I really sincerely believe that gatherings can be safe. I mean, not and to the point that it should be like normal times, because it really, in the past, we've always worried about flu. At least on my end as infectious disease doctor, we've always worried about flu in the holidays, and I've always worried about bringing flu to my dad, who's very frail. So we're kind of getting to that situation with COVID, but the important things is that we really know a lot more details and have a very effective vaccine, even better than the flu vaccine, and in most years, how well it can prevent. So really just thinking of everything and layering them up, that would be my approach, and to enjoy these holidays.
Dr. Wu, thank you so much for joining me. I wish you a wonderful Thanksgiving. I hope you have a very safe trip home to see your parents. And for everyone watching, please remember fully vaccinated people are at a much lower risk of serious COVID-19 related health problems, but all of us should be careful over the coming weeks, particularly if you plan to be among crowds or at large family gatherings. If you're traveling, please do not take COVID-19 lightly. COVID-19 is a threat to all of us, but the threat is seriously reduced if you are vaccinated. Thank you so much for watching, everyone. Please have a wonderful and safe holiday.